As the push to vaccinate more Virginians continues, local health leaders are warning of a new variant of COVID-19 believed to spread more quickly. 10 News reporter Annie Schroeder joins us live tonight with the very latest on how this new strain could impact people here in our area. Annie?
Well, John, while Virginia has more than 40 reported cases of the Delta COVID-19 variant, none of them are here in Southwest Virginia tonight. But officials are warning that those who are still unvaccinated for COVID-19 could be putting themselves at risk. The highly contagious Delta coronavirus variant is here in the Commonwealth, and health leaders predict it is here to stay for a while.
I think most of us think it's a matter of time, and just to keep in mind that the Delta variant is more transmissible than the other strains of COVID-19.
While none have been found here in the southern portion of the state, low vaccination rates means once it is here, it could cause cases to skyrocket.
It has multiplied quickly here in the United States. We've already had over 40 identified cases here in Virginia, but across the U.S., at the end of May, the Delta variant was 2% of new cases. Now it's more than 10%. I expect that to multiply very quickly and become the predominant strain here as well.
Right now, most local health districts in Southwest and Central Virginia only have about 30 to 40% of their populations fully protected. So the push for vaccination is stronger now than ever.
What that means for people who are not vaccinated is that there will be, an emergent, much more contagious version of COVID that will pose a threat in those communities that have low vaccination rates.
Health officials advise that if you are still choosing not to get the COVID-19 vaccine, the best way to protect yourself from contracting the disease is being vigilant.
If you're not going to get vaccinated, continue to wear a mask. There is still circulating disease, and while if you're fully vaccinated, you don't need to wear a mask in most settings, if you have not been vaccinated, we would really encourage you to do that.
Now, some local health districts are planning to continue their COVID outreach efforts for at least the next 2 years to help reduce the spread of those variants and potentially provide a second dose of the COVID-19 vaccine down the line. In Roanoke tonight, Annie Schroeder, 10 News, working for you.